What if I told you moving to the right country means you never pay a hospital bill again? Before we dive in, let me ask you something. How much did you spend on healthcare last year? $5,000? $10,000? $50,000? For millions of Americans and people around the world, one unexpected hospital visit can wipe out a lifetime of savings. But what if I told you there's a group of countries, some you probably never considered, where expats walk into hospitals, get treated, and walk out without ever seeing a bill? And here's the kicker. Some of these countries don't just cover you, they cover your family, your prescriptions, your dental, even your mental health. And in 2026, with new policy changes, visa updates, and international agreements, the game has completely changed. So hit that like button, drop a comment telling me which country you're most curious about, and let's get into it. How expat healthcare actually works. Here's the truth. Most countries with universal healthcare do make it available to foreign residents, but the key word there is residents. There's a massive difference between being a tourist. You get emergency care in many countries, but you're usually billed for it or expected to have travel insurance. Being a legal resident, once you hold a long-stay visa or residence permit, most universal healthcare countries will enroll you in their public system, sometimes automatically, sometimes after a waiting period. Being a citizen, full, unconditional access, no waiting periods. The countries in this video fall into 4 categories. Category A, completely free, no contribution required. Rare, but they exist. Category B, free after paying into Social Security or national insurance. Very common. Category C, heavily subsidized with small copays, still incredibly affordable versus the US. Category D, free emergency care only. Less ideal, but still valuable. Portugal. Portugal has the SNS, Serviço Nacional de Saúde, which is their national health service. It's been ranked consistently as one of the better public healthcare systems in Europe, offering everything from primary care and specialist consultations to surgery, mental health services, and maternity care. As an expat, here's how you access it. Once you obtain a long-term visa, this could be the D7 passive income visa, the NHR visa, the digital nomad visa, or simply a residence permit, you can register with a local health center called a Centro de Saúde. Wait, what? So if I move to Portugal on a D7 visa, I get free healthcare? Essentially, yes, but there's a nuance. During your visa application, you must show private health insurance. Once approved and resident, you switch to SNS. Spain. Spain operates a national health system called the SNS, Sistema Nacional de Salud. It's funded through taxes and Social Security contributions. Here's the beautiful part. It's not just for citizens. Legal residents get the same coverage as citizens. That means primary care, specialist visits, hospitalization, emergency services, mental health services, and even some dental care for children and emergencies. Prescriptions? Heavily subsidized. We're talking 1 to 5 euros per prescription. For expats, access works like this. Once you're a legal resident in Spain, whether on a non-lucrative visa, a digital nomad visa, a work permit, or any long-term residency, you can register with the municipal registry, empoderamiento, and then apply for a health card, tarjeta sanitaria individual. If you're working and paying into the Spanish Social Security system, you're automatically entitled. If you're retired or on a passive income visa, access depends on your region. Some regions, particularly Andalusia and Valencia, have been more inclusive with access for non-contributing residents. Greece, the Greece Golden Visa program and Digital Nomad Visa both open the door to residency, and once registered with AMCA, the Social Security number, healthcare access follows. Greece is an underrated option, relatively low cost of living, beautiful environment, and accessible public healthcare for legal residents.
Malaysia has a 2-track healthcare system. The public system, heavily subsidized, available to citizens and permanent residents, and a robust private sector that's extremely affordable, even by global standards. For expats, the public system is technically accessible, but often difficult to navigate without permanent residency. However, Malaysia's private healthcare is so affordable that it effectively functions like free healthcare for most expats' budgets. Malaysia My Second Home, MM2H visa holders and permanent residents can access public facilities at subsidized rates. A hospital visit might cost 5 RM, about $1.10 USD for a foreigner at a public clinic. Yes, really. Indonesia, Bali. Indonesia's national health insurance program is called BPJS Kesehatan. It covers Indonesian citizens and some visa categories. For expats on work permits, KITAS, BPJS enrollment is mandatory and provides access to the public system. Monthly costs are as low as 42,000 IDR, about $2.50 USD per month for the basic tier. Yes, $2.50. The quality in the public system is variable. In Jakarta and major cities, quality is acceptable. In Bali and more remote areas, expats typically combine BPJS with private clinic visits for better service. Costa Rica. Costa Rica is the undisputed king of healthcare for expats in Latin America, and it's been quietly known in retirement circles for decades. The Caja Costarricense de Seguro Social, affectionately called La Caja, is Costa Rica's public healthcare system, and it is remarkable. As an expat with legal residency through the retirement visa, pensionado, rentista visa, investor visa, or permanent residency, you can enroll in La Caja. The monthly contribution is income-based, but typically ranges from $50 to $150 USD per month for retirees. For that monthly fee, you get full access to the public system, including specialists and hospitalization. Brazil. Brazil's SUS, Sistema Único de Saúde, is one of the largest and most ambitious public healthcare systems in the world, providing free healthcare to all residents, including foreigners, regardless of immigration status. Yes, you heard that right. Brazil's constitution guarantees the right to health as universal. Emergency care, hospital treatment, surgeries, primary care, all available regardless of documentation. For legal residents with CPF, the tax identification number, and registered residency, access to the full SUS is automatic. Argentina. Argentina's public healthcare system is universally accessible, free for everyone, residents and tourists alike, at point of care. The system covers emergency care, hospitalizations, surgery, and primary care. Large public hospitals in Buenos Aires, like Hospital Italiano and Hospital de Clínicas, are impressive facilities. The challenge is Argentina's economic instability has strained public healthcare funding. Quality and availability can vary. However, private healthcare in Argentina is extremely affordable, especially given the favorable exchange rate for those earning in USD or euros. Mexico. Mexico's healthcare landscape for expats is one of the most pragmatic in the world. The public system, IMSS, Instituto Mexicano del Seguro Social, is available to legal workers and can be voluntarily joined by residents. The IMSS voluntary program, called IMSS Voluntario, allows foreign residents to enroll and pay annual premiums that are incredibly low. In 2026, IMSS voluntary coverage for foreigners costs roughly MXN 3,000 to 7,000 per year, about $150 to $350 USD annually, depending on age. That's for comprehensive public health care, hospitalizations, surgeries, specialist care, medications. Uruguay. Uruguay is one of Latin America's most stable, livable countries, and it has a genuinely impressive healthcare system. The FONASA SNIS system provides universal access to healthcare for all legal residents. Legal residents contribute through payroll or as self-employed individuals, and in return receive comprehensive healthcare through mutual aid societies called mutualistas or public facilities. Colombia. Colombia's healthcare system has transformed dramatically over the past 2 decades, and today it's often cited as one of the best in Latin America, both for quality and accessibility. Medellin, in particular, has world-class clinics and has become a hub for medical tourism and long-term expat living. For legal residents, Colombia's EPS, Entidades Promotoras de Salud system provides comprehensive coverage. Self-employed residents and pensionados contribute based on income, typically 12.5% of declared income, and receive full access to the contributory healthcare regime.